Hello everyone, welcome to our online course, Fundamentals of Nursing. I'm Zeting Wu from the first affiliated hospital of Shantou University Medical College, China. Today we'll discuss administration of oral medications. Here are the learning objectives for this section. First, describe the purposes of oral medication administration. Second, demonstrate the steps how to do this safely. Third, explain special precautions for certain oral medicines. Compared with other routes of medication, oral drugs have some advantages. They are easier, safer, more convenient, and economical. However, because oral drugs need to be absorbed through the gastrointestinal tract, patients with NPO status, inability to swallow, nausea or vomiting, and disturbed GI functions should not take medicine orally. Besides, we should not give oral medication to unconscious patients to avoid aspiration. One special route of oral administration is sublingual, which has a very rapid onset. So in clinical practice, when our patient's blood pressure is very high and we need to decrease it rapidly, our doctor will prescribe a sublingual antihypertensive drug. Even though oral medication is recognized as the safest way, in order to get optimal efficiency, we need to instruct our patient to take drugs correctly and safely. Now let's go through the procedures of giving oral medicines. For example, tablets or capsules. Accurate assessments and full preparations can avoid medication errors. We need to first assess the patient's condition and treatment options. For example, whether he or she has a history of allergies, how are the vital signs, renal and liver functions. Check any contraindications for oral medication as mentioned before. In clinical practice, assessment of swallowing ability is very important, especially for elderly patients. We'll use the dysphagia screening tool to assess the risk for aspiration. Moreover, we should communicate with our patient to get their cooperation and understanding before we give the medicines. Then assess the patient's knowledge about health and medication use and their ability to take medicine properly. After a thorough assessment, we need to make sure that the nurse, medications, environment, and supplies are well prepared. Regarding the supplies include a dispensing card, the medication administration record, MAR, disposable medication cups or pouches with medication, a drinking cup, pill cutter, and a straw. If the medicine is liquid, a calibrated medication cup and dropper are required. Now let's start to give drugs to our patients. The first and essential point is checking. Check accuracy and completeness of MAR with the doctor's order. Check patient's name and drug name, dosage, route and time of administration. Please remember to clarify incomplete or unclear orders with the doctor before administration. Second, assist the patient to a sitting position or side lying if not possible. Make sure the patient understands the purpose and precautions of different medicines. Next, administer pills one at a time, ensuring that each is swallowed before the next is given. After we finish the jobs for one patient, we need to clean our hands first before moving to the next patient in order to prevent cross-infection. When we complete distributing all the drugs, we dispose of all supplies appropriately. Remember to document the administration time, drug name, dosage, routes, and patient response timely. If the patient vomits after taking oral medicine, we need to report this to the charge nurse. Sometimes patients may refuse to take drugs. What should we do? We should first try our best to offer explanation and encouragement. If this still doesn't work, we'll notify the doctor and document this according to the hospital policy. So far, we've learned the procedure of administering oral medication. Throughout the process, everyone needs to adhere to the following points. First, check 3 times for safe medication administration. 2. Do not take medicine with tea or coffee. Take it preferably with warm water. 3. If the patient has difficulty swallowing, grind tablets in a pill crusher. Mix them with drinks or soft food. Then tell your patients as soon as possible if the drug dose changes. And last one, we need to assess for any contraindications for oral medications. Besides, different medicines may have different pharmacological properties that need our attention. So check with the pharmacy before crushing tablets. Capsules, subtent reliefs, and tablet-coated buccal and sublingual tablets should not be crushed. Besides, certain medicines can erode teeth, such as liquid iron supplements. We need to tell our patients to take such medicine with a straw, gargle, and clean teeth afterwards. Moreover, we need to adhere to the correct time of giving medicines. For example, a patient has been taking an oral medication after meals, which is not well absorbed in the presence of food. Therefore, the nurse should explain why this practice needs to be changed. The table shows you the optimal administration time of different medicines. We have responsibility to check the label carefully before giving a new medicine. Finally, let's summarize the key points in this section. Today, we have discussed the procedures of administering oral medications. In addition to give drugs safely and correctly, we should fully inform our patient the precautions for taking oral medicines and make sure they clearly understand. Here are all the references. Thank you for joining us. See you next time.